I'd like to invite Dr. Agarwal to the podium to present a paper entitled "Do Dietary Spices Impair the Patient-Reported Outcomes in Stapled Hemorrhoidopexy, a Randomized Control Study?"
Good afternoon and greetings from India. Thank you very much, Chairperson Ma'am and Chairperson Sir, for a nice introduction. As we all know, hemorrhoid surgery patients tend to avoid because of the perceived poor outcomes after surgery in terms of pain and especially at time of evacuation. Stapled hemorrhoidopexy has changed the scenario. It has become popular because of short-term, better patient-reported outcomes. But still the pain remains a very important patient-reported outcome, being the index of other outcomes. The pain, as I said, is usually troublesome, which is evacuatory or immediate post-evacuatory. It can also be accompanied by perianal pruritus, perianal irritation, itching. And traditionally in Indian diet, spices are used in plenty, and Indian curry is very spicy. And patients are traditionally used to avoid any traditional Indian diet for about 3 months after any surgery. They switch over to a very bland continental kind of diet. But definitely it is an important factor in deciding about surgery or avoiding surgery, and it impacts their quality of life. So this surgery evaluated with the advent of stapled hemorrhoidopexy, when there is no open wound in the lower rectum and anal canal. Is it necessary to keep avoiding the spicy Indian curry, or can we resume it? Now, spices are traditionally rich in curcumin and piperin, two chemicals which are now being studied intensely, and they have been found to have pro-healing and anti-inflammatory properties by their modulatory action on cytokines and interleukins, and they have a very potential antioxidant, anti-inflammatory properties, and they are effective as a therapy even at nanomolar levels in some other settings, but they have not been studied in post-operative wound healing points. As I said, the patient-reported outcomes are important deterrent for deciding about pile surgery, and patients keep on avoiding the diets. This is, we designed this study to study the effect of dietary spices on any adverse patient-reported outcomes following stapled hemorrhoidopexy. It was an open-ended prospective study from July 2008 to August 2009. All consecutive patients of candidates for hemorrhoidopexy without any exclusion criteria were included, and they were randomized according to date of birth protocol. And study group composed of spicy diet patients were instructed to resume their normal Indian spicy curry diet, while the control group was told that they can continue with their belief that spices have to be avoided after surgery. And a standard clinical sheet was used to record the pre-operative, per-operative data, and appropriate statistical analysis was done by a statistician. The endpoints were studied at the end of 3 days, first week, third week, and patients were asked to maintain a pain diary based upon a 100-point visual analog scale. They were asked to maintain in diary the presence or absence of evacuatory pain, perianal pruritus, irritation, and paracetamol 650 milligram was used as a rescue pain medication if they felt it was discomforting to pass stools, or there was significant pain that is more than 25 points on 100-point visual analog scale. Any adverse event that precluded discharge from the daycare surgery or needed re-intervention, re-hospitalization was the withdrawal criteria, as was the patients who could not maintain the diaries, and any presence of squamous epithelium on histopathology, because that was an indicator that the staple line is low and it's anyway going to be painful. A total of 67 patients were randomized. They were well matched for demographics, comorbidities, type of anesthesia, and grade of hemorrhoidal symptoms. 19 patients failed to withdraw failed to maintain the diary, hence were withdrawn from the statistical analysis. There were no withdrawals because of the adverse events or the abnormal histopathology. This is a table showing the demographics in relation to age, gender, grade of hemorrhoids, clinical symptoms, and type of anesthesia used were well matched. The study group, total patients randomized were 32 and control 35. After withdrawal, which is 7 and 12 respectively from study and control, the studied patients the analyzed patients included 25 from study group and 23 from control group, and they were statistically not significantly different. It was seen that in study group, perianal pain, burning sensation, and irritation was not different till the day 3. But after the day 3 in the week 1 follow-up, it was rather better in the patients who had resumed the spicy diet, and there was no difference. None of the patients reported any discomfort at the 3rd week. Same results were paralleled by in terms of the uses of total analgesic rescue paracetamol tablets, although the difference was not significant initially, but it was significant in the first week and the subsequent follow-up. So this is a very small study, but we could draw a lesson that traditionally patients are avoiding spices, and we had an intuition that with advent of stapled hemorrhoidopexy, there is no need to avoid spices because there is no open wound. But this intuition was not supported from any data, and spices are very important in Indian diet, and diet is important indicator of quality of life. So this study at least indicated that resumption of spicy diet did not have any adverse outcomes on the patient-reported symptoms of stapled hemorrhoidopexy. Thank you very much.